My name is Matthew Kolek. I'm a cardiac electrophysiologist, a heart rhythm doctor that practices here at Jupiter Medical Center. One of my areas of particular specialty is treating patients with atrial fibrillation, or Afib. Afib is very important because it is the most common heart rhythm problem in America. In fact, approximately 8 million Americans today have atrial fibrillation. In addition, atrial fibrillation is projected to grow to be an even bigger health problem, with up to 16 million Americans by 2050 having Afib. Now, atrial fibrillation is important for three main reasons. Reason number one is atrial fibrillation can cause symptoms and really interfere with somebody's quality of life. The typical symptoms that people present with Afib include things like shortness of breath with exertion, palpitations, fatigue, and lightheadedness. And the symptoms can vary from very mild, subtle symptoms to quite severe symptoms that make people come to the emergency department. Number two is atrial fibrillation, if left untreated, can actually cause heart failure. So what that means is the Afib can cause the heart muscle, the ventricle, to start to weaken, and that can cause worsening shortness of breath, fatigue, swelling, and other problems. And then the third important thing is that Afib is a major risk factor for stroke. I'm sure you've seen on TV commercials for medications such as Eliquis and Xarelto. Those are blood thinners to prevent blood clots from forming in patients with Afib because they can have a stroke. Now, for people that have symptomatic atrial fibrillation, we really do try our best to make sure that their symptoms are controlled by keeping them out of Afib. We do that with a variety of methods, medications that work on the electrical currents within the heart cells to try to keep people out of Afib, and also procedures such as cardioversions. And here at Jupiter Medical Center, we're able to offer patients all these treatment modalities, including the most sophisticated treatment for Afib, which is an Afib ablation procedure, a minimally invasive procedure that's done in the heart to treat Afib and try to prevent it. My favorite thing about practicing here at Jupiter Medical Center is the collaborative environment that we have. We have experts not only in cardiac electrophysiology, like myself, but also non-invasive cardiology, interventional cardiology, imaging specialists, as well as cardiac surgeons that allow us to treat each individual patient with a very collaborative and holistic approach to make sure that they get the very best care that they can possibly get.